You were in the hospital at the time of the strike, but in the operating room, can you just take us through what that was like, what you heard and saw at the time?
Yeah, actually, I was in the ICU, which is on the fourth floor. The male surgical ward, which is what was destroyed, is on the second floor. That's where most of my patients are. I just didn't happen to be there at that moment. In the ICU, there was a guy, probably 19 or 20 years old, who was injured earlier today, was operated at another hospital, and then sent here for further care. He was bleeding to death in the ICU, and we needed to take him to the OR. And we were actually getting ready to wheel him over there when the explosion hit the hospital. Course, everything shook. Everyone just kind of stopped, and then me being a foreigner, I'm not Palestinian, I'm not Arab, I don't speak Arabic, but because I'm a foreigner, they all made sure that I was safe first, and then the hospital was basically on lockdown and not doing anything for an hour. Thankfully, we were able to get that guy into the OR later. I just got out of that operation now, and but yeah, actually, when I got out of the OR, I went down to the emergency department, or excuse me, when I got out of the ICU, I went down to the emergency department once they allowed us to move around the hospital again. And the first thing that happened is a patient was brought down from the second floor, and he was brought down by his family members wrapped in a sheet, and they put him on the gurney, and I just followed in. And as soon as they opened him up, I realized I think his name is Ibrahim. I had operated on him about 5 days ago. I had to give him a colostomy. He was about a 16 or 17-year-old boy, and he was going to be discharged tomorrow, and he's dead. So.
Yeah, can you give us an idea of the damage to the hospital and how that's going to impact its operations from now and ongoing?
Yeah, thankfully the surgical ward is where the patients stay, not where operations are done. So we can still do surgery. Thankfully, the OR doesn't seem to have been impacted directly, at least. But Nasser, I believe has 450 beds. Now 50 of them are gone. 40 or 50, I'm estimating, but something like that. And so yeah, and that's going to impact care. The fewer beds we have, the less care we can provide, the less the earlier we're going to have to discharge people back to their totally unsanitary living conditions, the more likely wounds are to get infected, et cetera, et cetera. Um, but more so, I just worry that people might try to just deal with their medical problems at home, because they know that the hospitals are not safe, and that's an absolute tragedy. Hospitals are always supposed to be safe zones, no matter who's in them, no matter what the conflict is, no matter how evil you think Hamas is. You're not supposed to bomb a hospital just to kill somebody who's a patient there. That's not how it works. I mean, it looks like you're playing some video of the Palestinians trying to put the fire out. I don't know if people can tell in that picture right there, but the bomb seems to have gone directly through the sign outside that says Nasser Medical Complex. As far as I know, the intended target, whose name I can't remember, I think I might have operated on him too, actually. And the young man that my other patient who were both killed. As far as I know, they're the only two fatalities. Plenty of people were hurt, but thankfully they all needed sutures and smoke inhalation treatment, things like that. But these were all people who, it was what, 8 o'clock, 9 o'clock at night, at a hospital. So it was mostly people who were already seriously injured, and most of the people on the male surgical ward and the female surgical ward actually were injured on March 18th and 19th when the resumption of bombing happened. So they were already trauma patients, and now they've been traumatized for a second time.
This is the second time that you personally have travelled from the US to Gaza to work in hospitals there. How have things changed since you were last there, I believe in April of last year?
Yeah, I was here from March 25th to April 8th. I was actually in a different hospital. It's on the eastern side of this city. But in general, how things have changed, they've actually gotten worse. The hospital itself has gotten better. It's easier to work in this hospital than it was when I was at European Hospital, because back then European and Nasser was the same. I just didn't happen to be here. The city, or excuse me, the hospital itself was actually a displaced persons camp. People, families actually were lining the hallways, living in improvised tents. And then once the Israelis attacked and laid siege to the hospital in February and March and emptied out and destroyed most of Nasser, and then it was kind of put back together after that. The hospital administration decided we're not going to let refugees come into the hospital just because it makes it impossible to function. So it's actually been easier to operate and work here, but the people, these people have been hungry for 15 months. They haven't had enough protein, especially to eat for 15 months. They're all very, very vulnerable to injury and especially to infection after injury. And I'm still seeing the same rate of infection that I saw when I was at European Gaza Hospital. And it's absolutely devastating. We operated on a 6-year-old boy on the Monday, the morning of March 18th. He had 2 holes in his heart. His liver was shattered. But we got him off the operating room table. He died of sepsis just 12 hours later. We had the same thing actually happened to a 29-year-old woman. She didn't die of sepsis. She bled to death just because the hospital's blood bank couldn't support her needs. So the situation is still extremely bad. It was before the ceasefire ended. It was when Israel cut the borders on March 2nd, and it was even before that.
Yeah, I guess that goes to my next question in terms of what equipment you have access to, given that there are blockades on aid at the moment. Can you explain to us what sort of injuries you're dealing with, what sort of equipment you have access to, and how you are able to operate?
Yeah, it's what's March 24th here now. And on March 2nd, so I guess 22 days ago, the Israelis, with U.S. backing, said they were going to completely close the border. No food, no water, no hospital resupply, no electricity, nothing. Behind me is Khan Yunis, and there's the city lights are all completely out. And right now, and actually also behind me, which I'm sure you can't see, is the hospital's warehouse, which has been burned. The Israelis destroyed it when they were here in March, and there's no capacity to rebuild it. So the hospital doesn't even have a significant warehouse where they can keep a strategic supply of surgical resources, antibiotics, simple medications, things like that. Right now, we still, I think I mentioned, I just got out of the operating room. We still have everything we need from the basics. We're not missing any of the bare minimum basics, but if we keep getting mass casualty events, and certainly if Israel keeps bombing our hospital, then we're really going to be in trouble in terms of providing the care that these civilians need when they're injured.